All right, we're going to finish out the Unit 3 physiology side here by discussing some joint injuries and disorders that can occur within the joints. This is important information for all of you guys going into the health sciences, and I'd say especially for those of you planning to go into the physical therapy assistantship programs. So some common joint injuries. Now, we've all heard of this before. What is a sprain? Like you sprain your ankle. That's not the same thing, of course, as breaking a bone. A sprain occurs when you have stretched or torn ligaments that connect bones together, the ligaments at a joint when they get stretched or torn. When a ligament is partially torn, again, you've got dense, regular connective tissues here, poor blood supply, they don't heal very well. A partially torn ligament will heal itself slowly, takes a while. You got fibroblasts in there that will regenerate those tissues, but it's going to be slow. But a completely ruptured ligament, which would greatly destabilize the joint in all likelihood and make those bones pretty wiggly at that location, that's going to require surgery to actually suture those two pieces of the torn ligament back together so that healing can actually take place. And if you've ever sprained your ankle, you know how long it takes to get over something like that. Okay, cartilage can also be torn, so the articular cartilages at joints can be torn or injured due to compressive forces. As you get older, these types of things are more likely to happen. Or shearing, like if a joint takes a blow and the cartilages get ripped or torn. Sometimes pieces of the cartilages can actually tear off and they wind up getting into the joint cavity inside the synovial fluid there and can actually cause the joint to lock or bind up, so that would reduce the movement that you would have. Unfortunately, hyaline cartilage is not very good at repairing itself. It has a poor blood supply. So when those types of things happen, you're probably going to have arthroscopic surgery at the joint, where they have an opening at the joint and stick a little scope in there and instruments and make repairs. And this is also important when we're thinking about the meniscus or the menisci at the knee joints. When they get injured or they get worn out over time, they're not going to be able to repair themselves. So if you have major problems at those locations, it could take surgery to repair them. All right, dislocated joints. It's another type of common joint injury. These are also called luxations. And that's where, your two bones are forced out of alignment. And so, of course, when that happens, you've almost certainly got sprains that have occurred where ligaments have been torn or stretched, and that's why damaged in some way, which is likely what caused the bones to become loose enough so that they could luxate or dislocate. Serious falls, playing sports are the typical causes of those types of things. A subluxation is where you have a partial dislocation of a joint. So the bones don't necessarily completely pop out of place, but are partially popped out of place and not aligning like they're supposed to. Okay, some of these things we've talked about before here. Bursitis, not an uncommon problem. That's where you have inflammation of a bursa, and that's usually due to repetitive use, the friction, the bursa tissues rubbing up against things over and over, or if you have a blow like to the knee, like to the patella, that might injure the bursa that's located right there underneath the skin and sitting over the patella, superficial to the patella. You can get inflammation of that, and it becomes very painful to the touch. And a type of treatment is rest and ice. So ice treatment helps reduce inflammation. Resting it can help give the bursa time to heal. And sometimes you have to take anti-inflammatory drugs, things like ibuprofen and Tylenol to help reduce the swelling and the pain and so forth. And sometimes inflammation gets out of control and it makes healing difficult. Tendinitis, very similar to bursitis, and that's usually due to an inflammation of the tendon sheaths. So again, a tendon sheath is like an extended bursa that wraps itself around a tendon and helps reduce some of the friction between the tendon and other structures at a joint, like up at the shoulder joint. And that tendinitis typically occurs due to overuse. Treatment's very similar to what you would do for bursitis, resting and icing that location. Okay, how about arthritis? Arthritis literally, all right, so if we're thinking about arthrology, I don't think I mentioned this, but arthrology is the study of joints. That's also where the word articulation comes from. So arthritis literally means joint inflammation. Anytime you see itis, that's inflammation. So there are many different types of arthritis. Over 100 different types are known that result in inflamed joints and damage to joints. Very common, most widespread crippling disease in the United States. You can have pain, stiffness, swelling of the joints. If you have swelling around a joint, that's going to reduce your range of motion. That makes sense. That's why your joints become stiff. There are different types. You can have arthritis that's actually caused by bacterial infections, and those are treated by antibiotics. One type of bacteria that causes arthritis is the Lyme disease species of bacteria, which you'll probably learn a little bit more about in your microbiology class when you have that. But that is a type of bacteria carried by deer ticks, and if the deer ticks bite you, they can inject these bacteria into your bloodstream. And if you don't get treatment in time, the bacteria will actually invade the joint fluids, and that can lead to inflammation. Your immune system is going to come in and try to kill these bacteria, and so you have inflammation that's taking place while your immune system is doing that, and that can lead to arthritis. And then there are chronic forms. So acute forms, when you see acute versus chronic, acute means generally shorter term and intense. So acute forms of arthritis caused by bacteria can be treated. Chronic forms are longer lasting, difficult to treat. And there are three types of that. You have osteoarthritis, rheumatoid arthritis, and then gouty arthritis. So we'll talk about a little bit about what those are. Well, I thought I had a separate slide for that. I guess I don't. So I'll just talk about it on this slide. Let me bring it back up here. Let me talk about what those are. Okay, so osteoarthritis, osteo referring to bones. Literally, this is the type of arthritis that occurs due to wear and tear. So as you get older and your articular cartilages at your synovial joints wear down and get thinner and thinner, and maybe you're not producing as much synovial fluid anymore, you can start to have bones rubbing up against bones, and that damages the two bones at the joint. That triggers inflammation at the joint, so you have that pain and that stiffness, the heat. You know how people who have arthritis will talk about their joints feeling hot? Inflammation stimulates increased blood flow to tissues where that's occurring, so that's why it feels hot, because you've got all that warm blood flowing much more abundantly to those areas. Rheumatoid arthritis, when you guys see rheumat like that, that is referring to autoimmune diseases. A rheumatologist is a doctor who specializes in autoimmune diseases. This is where your immune system is attacking your own tissues. That's an autoimmune disease. So rheumatoid arthritis is a type of arthritis where your immune system is by mistake attacking joint tissues. Okay, and as that happens, that leads to inflammation, And so you have the swelling and the stiffness and the redness and the heat occurring there. And then finally, gouty arthritis. Gout is caused by uric acid crystals. That get deposited in joints. Uric acid is a waste that is derived from nucleotides. So your DNA and your RNA nucleotides, when those get broken down because they're no longer useful, uric acid wastes are molecules that are a waste product from those. So they're partially broken down nucleic acids. Now ordinarily, those get filtered out of your blood in the kidneys, and then you pee out uric acid in your urine. Uric kind of sounds like urine, so that makes sense. But in people who have gout, which can occur in people whose kidneys are not functioning all that well, it's not filtering this uric acid out quite as well. The uric acid can actually infiltrate into the joint fluids. It comes out of the blood vessels and gets into the synovial fluids. Remember, your fluid compartments, things move from one fluid compartment to another. So you have little tiny blood vessels in the synovial membranes of your joints. And if you have uric acid passing through there, it gets out of there into the synovial membrane. The synovial membrane sends the uric acid into your joint fluids. And if you have excess amounts of uric acid in your body fluids, it can be so concentrated in the synovial fluid that it actually clumps up and forms crystals. You know, kind of like if you have, let's say you had a glass of salt water sitting out in your kitchen and you let the water evaporate out, you know, what's going to happen? You're going to come back and you're going to see crystals of sodium chloride in that glass of water as the water levels get lower and lower and lower. Same thing with uric acid. As the uric acid concentrates in your synovial fluids, it can actually form crystals. And then those crystals can be damaging at the joints. You don't have a lot of space at these joints. I mean, think about like your knuckle joints and the joints between your individual fingers and other joints as well. There's not a lot of space there. So if you have these crystals, which can be kind of sharp and damaging, that can damage the joint tissues and that can lead to arthritis. And so that's what we know as gouty arthritis. All right, so that was just kind of a short, quick overview on some different joint disorders that you should be familiar with. And that concludes Unit 3. So as with all of the units, you just want to try to use your Mastering A&P homework questions to help you review any of these little fun quizzes I've got built into Blackboard. You can use those to help you review. And then also the bigger practice activities that I've got for the unit. Those will give you plenty of practice questions to work with. And as always, be sure you know why the right answers are the correct ones on those practice activities. Don't just try to memorize the questions and the answers. You really need to try to understand why the correct things are the right ones, because that means you actually know the material and you're not just memorizing words. So please let me know if you have any questions about any of the video lectures for Unit 3, or post them on Piazza. That would be the ideal thing to do so that other students can benefit from as well. Let me know if you need any help.